Good morning. My name is Devin Downey Smith, and I am the Communications Director at the Health Justice Recovery Alliance. I don't know how much you know or if you know anything about our organization, so I'll just give the quick Reader's Digest overview. We are the advocacy coalition that is solely focused on the implementation of ballot measure 110. So really working to ensure that the will of the voters is upheld. We do a lot of legislative advocacy, not just to defend the law, but also to make sure that legislators know about all the great work that providers are doing. And that's a big part of what I do, and my job has certainly gotten a lot easier since OHA finally released the money a couple weeks ago. So that's exciting. So now we're wanting to just make sure that y'all have the support you need, because we understand that some of these grants may be the biggest grant that you've ever received, and there's a lot of questions. So we're offering this series of technical assistance workshops, and we're very happy to have Kristen Cooper with us today from Blackbird Consulting, and she is going to talk about offering benefits. And I would say while Kristen is presenting, let's just put questions in the chat, and then she can answer throughout as it makes sense with her presentation. And then hopefully afterwards we'll have time for some Q&A. So with that, I'll turn it over to you, Kristen.
Great. Thank you. Good morning, everyone. I'm Kristen Cooper. My pronouns are she, her. I am the founder of Blackbird Benefits Collective. We are an independent employee benefits agency and brokerage. So what that means is we work with businesses to help them put in the benefits package that they offer to their employees. So a lot of questions come up pretty frequently around, like, how do I offer benefits? How do I get benefits? And, we hear from a lot of folks that it's just so daunting, and they're Googling, they're looking, they're searching. But the purpose of a broker such as myself, or many others that are out there, is to basically help businesses go through this process and get the coverage in place. So I want to talk a little bit about how to go about that, and the considerations to have, especially if you are looking at launching benefits for the first time. So the first thing to know is, in order to offer an employer-sponsored health plan, you need to have at least one W-2 employee besides yourself that will be with you and enrolling in the health plan on the date that you want to launch it. So for this purpose, that can't be yourself as the sole proprietor. You're not the one employee. It can't be your business partner or a shareholder or your spouse, even if your spouse happens to also maybe be a partner or work with you in the company. So it really truly needs to be you plus one W-2 employee. So that will put you in the small group market, which is 2 to 50 employees. So for the purposes of this, you will be looking at then who really is eligible to be offered benefits under your company. So that can be a full-time W-2 employee or a part-time W-2 employee. Temporary leased employees, seasonal employees, or 1099 contractors are not eligible to be covered under your health plan. So when you are really thinking about this initial launch, it's really going to be those W-2 folks that are working for you. So now that we know who can actually be included in this, there's a few key decisions that you need to make as you're getting ready to launch. So the first is for the employees that work for you, how many hours do they need to work in order to be eligible to have your health plan? And the second is, if you hire a new employee, how long do you want them to wait before they're eligible to enroll in your health plan? So if we've all probably worked for different companies in the past, you get hired, you've got a probation period, and then your benefits kick in. So those are the decisions that you're making here. Once you set these rules, then they are going to be locked in for the course of your plan year, which is going to run 12 months from the date that you launch. And then you will renew every year, every 12 months, basically, depending on whatever month you launch coverage. And you can launch any month out of the year. So determining the eligibility, the hours worked. So you can use your discretion to set the number of hours as long as it is 17.5 per week or more. So you've got some flexibility. If you're really trying to help people get part-time employees get coverage, you can absolutely do that. It just really depends on your budget and what you can afford, because I think we all know healthcare is pretty expensive. So what we typically see is most employers set the hourly requirement at you work a minimum of 30 hours per week and you're eligible for our health plan. And then that next piece to consider is the waiting period for newly hired employees. So you bring on a new employee, based on their date of hire, you can choose one of the following. So benefits could begin on the date of their hire, which is a little intense. It can be the first of the month following their date of hire, first following 30 days from their date of hire, which depending on where that falls can end up landing closer to about 2 months. So if someone was hired on, the 5th of the month, they're not going to be eligible until, nearly 2 months later when that follows. It could be 60 days, or the longest you can have someone wait is coverage would have to begin on their actual 91st day of employment. And so that one gets a little bit weird because then you've got some mid-month enrollments. So it's a hard and fast rule. 91st day is when coverage has to begin. So typically what we see is most employers choose either, first of the month following date of hire, 30 days or 60 days, because then everything is consistently happening on the first of the month and it's a little easier for administrative purposes. So now that we've determined those things, we know who's eligible for benefits and when they're going to begin. So now we need to think about the type of coverage that you're going to offer. So for medical, there's a lot of options available in the small group market, but what it really comes down to is, do you like Kaiser? Do you want Kaiser? Or you look at everything else. So the different insurance companies out there are, Kaiser, Regence Blue Cross Blue Shield, Providence, Moda, Pacific Source, United Healthcare are kind of the key players for the small group market. So with Kaiser, it's a pretty unique model. It's primarily an HMO plan, which means all of your care is managed through Kaiser. They're usually the least expensive option available in the market because they do have that more contained model for care. So everything runs through Kaiser. You go there for all of your levels of care. It's all integrated together, your pharmacy, all your medical records. So any service that you go into Kaiser for, your medical records are linked together through their system. So that can be a nice way for people to access care. They also partner with the Portland Clinic. So for people that really have a doctor that they really want to stay with, you could offer Kaiser, but people have access to all the Portland Clinic facilities in Portland as part of their plan, and that's all covered as part of their plan. So that makes it a little bit more flexible in offering Kaiser as an option. Everything else out there is going to be more of the traditional PPO model. So a PPO plan is a preferred provider organization. So with a PPO plan, you have in-network and out-of-network benefits. You're always going to have the best benefits going in-network. So that's going to be the PPO doctors. You're going to go out to the website, you're going to search for your doctor. As long as they show up and say, yep, they're in network, then you're going to have much, much lower costs. This option is really nice because it's the most flexible for people being able to pick and choose which doctors and specialists they want to see. Typically, you can self-direct to the providers you want. You don't need a referral. There are a few health plans that do have some more restrictions around that, but generally speaking, having a PPO plan means a little bit more choice, actually a lot more choice in provider access. It can also be ideal if you have employees in multiple states, because we're now much more of a remote workforce these days. We have employees around the country. Having the PPO plan in place makes it so you have a broader access to in-network providers in all states offered. Whereas, Kaiser doesn't operate in every state. Most of the PPO plans have a national network of some kind. So something to consider there. Multiple plan choices. So you have to choose one medical company. So you can't do Regence and Kaiser basically side by side. A lot of people would love to do that, but unfortunately you've got to choose one. But the nice thing within that is that most of the carriers will let you offer multiple different plan designs. So that means you could offer a platinum plan, a gold plan, a silver, a bronze. All of those could be available as options for your employees to pick and choose from, so they can really kind of get the care that they need at the cost point that works for them. Dental and vision. So vision is usually baked into the medical plan. So that's not usually something you have the option to go out and shop for, but most of the small group plans, it's going to be included, and that's going to cover an exam and provide an allowance toward hardware, which would be like buying glasses or contacts. Dental is a separate line of coverage. It can usually be offered by the same insurance company as your medical plan, so that makes things easy. You get one bill each month to pay. But there's also a lot of companies that just do dental or primarily do dental, or think about like MetLife and Snoopy. They're a very big dental company. You can go direct as well. It just means that you'll set up payment auto pay for an additional bill to be paid. But typically when we're launching for the first time, we usually bundle medical and dental under the same company, so that while you're getting used to just having the coverage in place and everything, you've just got the one carrier, and it's just a little easier administratively. And then there's options for life insurance and disability protection. These are things that can be added at any time. A lot of businesses offer them, later down the road, just because of the, initial expense of launching benefits for the first time. But there are options you can pick and choose from. So life insurance is pretty straightforward. Short-term disability, this is something that would replace a portion of your income if you become disabled and you're unable to work. So usually there's a little bit of a waiting period that you need to fulfill before the benefit kicks in. But once it does, then it typically will replace about 60% of your income while a physician says that you can't perform the duties of your job. And that typically lasts for right around 3 months. And then from there, if the disability were to continue, then you could transition into a long-term disability plan, which would potentially be payable up to your retirement age. So when you do offer these types of coverage as the employer, you're typically going to pay the full cost for these plans. And it's something where once you determine your rules, like who is eligible, then any employee that is hired is going to automatically receive these coverages. For the medical plan, so the biggest thing to figure out here is cost, right? So thinking about the contribution structure, this is going to apply to medical and dental. The insurance companies require you to pay a minimum of 50% of the employee's monthly premium amount. So that is a single person covered under your plan. It's your discretion if you would like to pay a higher percentage. Some companies try to pay 100% of the cost for the employee if they can, but basically anywhere between 50 and 100% is what you'll need to pay. So as a starting point, we often start from that 50% split and then work up from there to see, what really is manageable for your budget. You're not required to pay anything toward people covering their family members. So if somebody wants to cover their spouse or their children, they can do so, but that would then be they would pay the full cost to have them on the plan. So your only requirement is toward the employee amount. What a lot of companies do, when we just talked about how you can offer a mix and match of plan designs, so you could offer a gold, a silver, a bronze, and so forth. What a lot of companies will do is set their cost share at 50% of the least expensive plan option. That meets the insurance requirement to offer the coverage, and then employees can then buy up to the different plan they want. Or some set it where they also offer a buy down option. So maybe you set your contribution at kind of a mid-range plan. Maybe you set it at the 50% of a silver plan. Employees can buy up to the gold, or they could buy down to the bronze, which is kind of an interesting way to do it, because maybe they don't have a lot of healthcare expenses, but having a lower premium in a bronze plan makes it a little more accessible for them to cover their family members. So that's kind of an interesting way that we've been setting things up lately, is just giving people a little more choice to choose what actually fits their family. And just like those rules around the hourly requirement and the waiting period, once you decide how much you're paying for the cost of benefits, then that's going to be locked in place and you're going to apply that to everyone equally going forward. So no paying 50% work for one person and 60 for this person over here. It's got to all be the same. So how do we actually get these benefits in place? So working with the broker, basically that's what we're here for, is to go out, help you get the quotes, help you implement the coverage. Your role in the process is to provide a census with your employees' demographic information. You'll send that over in a spreadsheet format. You're going to list all your employees, their dates of birth, gender, the zip code where they live. And if you think they'll be covering any family members under the plan, you'll want to include them as well. So once you've got your census ready to go, you send it over to the broker. The broker will go out and we'll run quotes for all the different options that we looked at. So we'll talk to you in advance about, did you want to look at Kaiser? Do you like Kaiser? Or would you rather really have a PPO plan as your preference? So once we know that, and we kind of know, where your starting budget is, we'll go out and run the quotes from all the different plans that are going to meet your needs, and take it and come back to you with a presentation to help you make your decisions. So that's going to be evaluated based on the options that you're interested in, which carrier then has the best rates and the best benefits, which one has the best access to providers, so the most robust network access. Do they have legacy and Providence providers? Are they only legacy? Are they only Providence? Do they include OHSU? Those are all things that we're considering as we work on recommendations. So then from there, we put together a side-by-side comparison of the plan options and kind of highlight the kind of key features of each one. So you get the pros and cons of what's good about each plan. And then we also provide a cost sharing breakdown. So we talked about, you need to pay the 50% of the employee cost. We'll kind of model that out based on each plan option and what it would look like for you and what it would look like the cost for the employee coming out of their paycheck to have that coverage. And depending on your budget, that can all be adjusted when you get the numbers in front of you and you're like, well, you know what? Okay, so we met the 50%. But we'd actually like to do better because we want to attract employees. We want to retain employees. We really want to have a desirable benefits package. So we can work with you then to kind of make little tweaks and adjustments to get that cost to where, you're hitting a sweet spot for you that you can maintain your budget. And also, it's favorable for the employees for what's coming out of their paychecks. So then implementing the coverage. So we've gone through the process. We've looked at all the options. We've made our decisions. We're going to offer a PPO plan with a gold, a silver, and a bronze for people to choose from. The broker then is going to collect all the applications. They'll fill them out for you as much as they can. You'll need to provide some of your company information. So your tax ID number, your workers' comp information, just some general structural business information. And then that should be all pulled together and sent over to you ready to sign. And then it's time to enroll your employees. So all of your existing employees, so those are going to be everybody that you included on the census that you provided, all of those people are going to be eligible to enroll on the effective date that you choose. So let's just say you're thinking you want to offer benefits for January 1 of 2023. So we're going to start this process. We're going to go out, we're going to get the quotes, everything's ready to go, and you're going to launch benefits on January 1. So everyone that is included on your census is going to be eligible to enroll on January 1. If they don't enroll during that time, then they've got to wait until basically the standard open enrollment period for the following year, unless they have a mid-year qualifying event. So those qualifying events are things like marriage, divorce, birth of a child, adoption, any of those things. Perhaps they didn't enroll in your health plan because they were covered through their spouse, and maybe they lost that coverage through their spouse. Now that is an opportunity for them to come over and enroll in your plan. So that's everybody who was your current employee base. And then throughout the year, anybody that you hire as a new employee, they'll be eligible to enroll based on the waiting period that you set. And if they don't enroll at that time when they're first eligible, then they would also have to wait until open enrollment for the January of 2024 plan year. So the employee experience in all of this, we're ready to launch, we're ready to get everybody enrolled. So the broker would prepare a nice communication packet for you. So that's going to be a nice little benefits guide that's going to say, hey, welcome to Blackbird. Here's the benefits that we offer you for your employer. Here are all the rules about, who's eligible, your family members that you can cover, when your coverage begins, when you can make changes. Here's the different plans that we offer in a side-by-side comparison. Here's the different costs per your paycheck. And then it will also include just kind of some key information about, here's the cool perks that come with your medical plan. Here's the gym memberships and fitness discounts and the wellness features and all those kind of add-on bits and pieces that are in there. So typically we would also do info sessions. So those are sometimes one-on-one, not as much these days, or in person, but Zoom sessions, all those kind of things where, we do kind of a similar presentation and it just says, hi, here's your benefits package. Here's how you find providers. It just walks you all through all the steps of accessing your benefits and getting enrolled. And then the broker would help you collect all the enrollment forms, get everything all put together and submits it to the insurance company on your behalf. So the final steps after that, so we've submitted everything, the carrier is going to get everyone enrolled, they're going to mail out ID cards. Your last piece is that you'll need to set up payroll deductions. So when we talk about that minimum 50% cost share of the employee amount, the 50% that the employee has to pay is going to be withheld from their paycheck on a pre-tax basis. So that's kind of nice because it reduces their taxable income. The way you set that up is once you know how everyone is enrolling and which plan they are enrolling in, we'll provide you a final spreadsheet that shows the cost breakdown of here's the total premium, here's what the company pays, here's what the employee pays. You'll load that into your payroll system and that will basically run the deductions from there. And then basically you'll be set up on that end. You'll have the option to then log into the insurance company website. That's going to be your kind of administrative portal. Typically for us, most of our clients set us up with administrative access as well. So that allows us to better support them and make sure that everything's working properly on the benefits. You can set up your bill on auto pay or an ACH push if you want to, but auto pay is kind of nice because once you set it up, you just don't really have anything else to do from month to month. And then once your benefits package is all up and running, then the broker that you work with should be there for you year round. So if you have enrollments for new employees that come on, they should process those for you. Termination for employees that maybe leave the company, that needs to be taken care of. If you have any billing issues that come up, claims issues that come up, typically we'll review your first invoice to make sure that everything is showing correctly based on how everyone enrolled during the enrollment opportunity. And then we also serve as a direct contact for employees when questions or issues come up. So, if they're having, they are getting weird bills in the mail and it just, insurance is confusing. It's hard to navigate. So, we're happy to serve as a direct contact for your employees to help them kind of sort those issues out. We can work through back channels to find out, really the root cause of what's causing the issue or the error and, save people some time calling, 1-800 numbers and customer service and all of that. So as much as possible, we try to advocate on behalf of your employees as well. The other thing that, we can help with is trying to help people find providers that are culturally appropriate. So that can be hard to search for in the general search engines, but we really try to do our best to keep our tabs on, community providers and really keep as many directories as we can create of culturally appropriate healthcare providers so that people can access care from someone that they feel safe with. So that's a huge piece of, navigating insurance is it's already kind of difficult, but then when you actually go to receive care, you should be able to get that care from somebody that you trust and feel good about. So That's kind of the whirlwind tour. I see a couple questions popping up here in the chat, so I'm just going to pull these up really quickly. Employees working part-time that will qualify hours-wise, they have Medicare and UHC. Can you speak to this, please? So an employee is working part-time that would qualify for hours. At the company side, it depends on company size, but depending if you're 20 employees or less, or 20 employees or more, determines if Medicare is primary or secondary. So there can be some coordination that way, but I'm not sure if this question is saying they have a Medicare supplement with UHC, or if they're currently covered under both. It looks like, okay, they have a Medicare supplement. So it really does depend on your company size if Medicare would be secondary or primary, but those things can coordinate. Then I see another question. What if right after the census was completed, we hired multiple people? What would happen is if we were still in the implementation process, we hadn't fully submitted everything as yet, we were still in the paperwork process, we would regenerate your quote with the updated census information to make sure that the rates that have been generated are the most accurate, so we don't get any surprises once we hit submit. If it happens after everything is submitted and approved, then they would just come into your health plan and be offered the enrollment opportunity just like everybody else. So a little bit more about the way that works too. So the rating process for medical is just solely based on demographics. So age, gender of all of your employees. So every little change that happens there on that front, I'm glad you brought up that question if your census changed, because if it does change through the quoting process, it will ultimately alter the rates. So who is submitted, like when the button is pushed, then that is what the rates are going to be based on. But then those rates are locked in for your plan year. So going back to the example, if we launched benefits on January 1, when the insurance company says, okay, your coverage is approved and these are your final rates, those rates are then locked in for the full 12-month plan year until you renew again January of 2024. So any newly hired employees that come in through the course of 2023 are coming in and they will be at the same rating structure that you have in place. So there's no change there. That's going to be consistent. The cost that you determine on a per head basis is going to remain steady throughout the full course of the plan year. And then when your plan comes up for renewal on January of 2024, the rates will be based on who your enrolled population is at that time. And that's how the rates will be generated out of the system. Let's see here. Any other questions coming up?
I have a question.
Yes.
Hi, Claudia Black with the Health Justice Recovery Alliance.
Hi.
And so just kind of two questions. One is, how do you choose a broker for people? Where do you find a broker? How do you choose a broker? And also, what does a broker charge for that service? Does it depend on the number of employees? Oh.
Those are wonderful questions. I wish I had remembered to include them in the slides. So as far as choosing a broker, there are a lot of options out there. There are huge brokers. There are a lot of local independent brokers. Really, I would say one thing to know is all brokers get the same pricing. So no broker is going to get different medical rates. Like broker XYZ cannot get different rates than Blackbird can get. So that's all kind of a level playing field there. What it comes down to is really relationship, I would say. So, you know, talking to people, understanding what their day-to-day service model is like. I think there's some variance in how much hands-on day-to-day service different brokers provide. So, you know, really how much help do you think that they're going to give you with like processing your enrollment and terminations, being a direct contact for your employees, those kind of things, like how available are they to you? And then really, you know, do they align with your values? Do you feel like, you know, you trust them to be respectful to all of your employees? That's a pretty big deal when people are reaching out for help with their healthcare. So I would just talk to people from that perspective, and a lot of it then finally just really comes down to the relationship of who you feel comfortable working with, and then pulling in the benefit pieces from there is just kind of a standard process. And then the compensation piece, we are compensated through commissions that are already built into the premiums. So it's basically on a per member basis. It's baked into the rates, whether you have a broker or not. So best to have a broker doing the work for you, for sure. So there aren't any additional fees typically for the standard scope of services. So that's going to be the marketing your programs, implementation, ongoing support, all of that. Different brokers have different kind of one-off different solutions that sometimes they'll provide for a fee basis, but those are optional and usually laid out ahead of time. But for the standard scope of service, that is built into the commissions.
Great, thank you. That's really helpful. One more question. Do people look under broker in the phone book? I'm being facetious, obviously, but do they, how do they find the list of brokers? Is it word of mouth? What's...
A lot of it is really referral based. And personally for Blackbird, we're entirely referral based. You can Google insurance broker for like a local insurance broker. There's also, if you're interested, the B Corp directory, if you're interested in working with B Corp businesses, which a lot of people are, because it's a nice business certification that shows that you're a really ethical company. So they have a business directory. You can go out and type insurance or benefits, and it'll bring up a list of people who work in that space. Otherwise, it's just kind of ask a friend, talk to somebody who feels like they're getting good service. It's all about the service. The price is the price. It's all about the service.
That's great. I feel like I've learned a ton today. Thank you.
Wonderful. Thank you. And I see another question. We work actually around the country. So our primary business is in the Pacific Northwest, but we've got clients all over the place, which is pretty cool.
Yeah.
Hey, Kristen, I have a couple of this is Kyle, and I'm driving, so that's why I can't type my question in. But
Sure.
I have two questions. One is, I think folks primarily that are going to be that are here or listening to this recording after the fact are nonprofits. Can you clarify? Nonprofits can have just one employee on the plan. Is that correct? They don't have to meet the two thing that you laid out at the beginning.
No, there is the requirement to have two people. So
okay.
I know that's tricky because often it'll be like the executive director or a board, and maybe like a full-time somebody else working full-time. But there really does need to be a structure there where where you're meeting the two in one way or another.
Okay, great. And my second question is, I heard you say, and I just from experience, I had an executive director once who built her benefits policy and her handbook to say like, oh, we'll pay this percentage of a premium for people who've been here 1 year and 3 years. And then she got really mad at the insurance company because they wouldn't let her do that. And I was like, I'm pretty sure that's like illegal. That's why it's not just that specific insurance company. And I think I heard you say that, right? Like you have to offer the same percentage to everyone. You can't tier it based on seniority or position or.
Yeah, you really do. They require that you set that, and that is locked into place for your full plan year. You can adjust it each year when your plan renews, but really you do need to provide that same level to everybody. If you have some kind of an agreement worked out with an employee where you're like, we're going to pay a little extra for you, that needs to be done on a gross up basis, which is going to become taxable income for them. So, if let's say the annual premium is $500 a month for this employee, you pay $250, they pay $250. If you decide you're going to tack on anything on top of that, then that would be taxable income for them outside of your standard contribution.
Yeah, got it. I mean, that's what I ended up doing for her. But I was like, I think you built your whole plan wrong. You got to change your handbook.
Yeah, yeah, that gets tricky. I mean, and I understand why people want to do it, but because there's all these IRS rules around anything that is done on a pre-tax basis, they're pretty sticky about it. So the other piece that you need to have in place too is just a plan document. So that is something that it basically just outlines, we offer this health plan, your cost is taken on a pre-tax basis. Here are the times, a year that you can make changes. These are the IRS rules around qualified changes and things like that. It's one of those things that, you just need to have in place because you're offering an employer-sponsored health plan. I don't know who was going to read it, but you need to have it. And either your broker can prepare it for you, or some accountants will do it, or other firms, but it's a pretty nominal cost to get the document in place, and then it's kind of evergreen once you have it there. You only really need to change it if you are really doing an overhaul of your plan. And then the other pieces that you can change at renewal, so contribution you can address, and also the eligibility rules that you set. So if you're finding like, wow, we said first of the month following 60 days, but boy, people are really having to wait a long time for their benefits to kick in. Each year at renewal is the time that you can make an adjustment and say, okay, we're going to switch down to first of the month following 30 and see how that goes. And if that's kind of helping us get through that. Or also, you know what, we really are having a hard time maintaining the cost for employees working 20 hours. So we are going to scooch it back up a little bit to, maybe it's 25 hours a week, or maybe we have to go all the way to 30 in order to really sustain our health plan. So hopefully that's not the case. Hopefully we kind of hit it right on the nose as far as the planning and budgeting process goes, but those are the times that you can make changes. Any other questions? Okay.
Well, thank you so much, Kristen. That was a lot of really informative, great info. So for everyone who's attended, we're going to be uploading Kristen's slides and then also the recording of this conversation onto our website, and I will email them out to you as well. And you'll probably have more questions later, so if you're interested in meeting with Kristen one-on-one, you can email me and I'll help you facilitate that. So thank you everyone so much for attending. And yeah, thanks, Kristen.
You're so welcome. It was lovely. Thank you for having me. I'd also just drop my email in the chat. If any other questions pop up, feel free to shoot me a note. I'm happy to share information that I have anytime.
Thank you very much.
Thank you. All right.
Thank you so much. Have a great day, everyone.
Thank you.
Thank you. Have a great day. Bye.